my name is Ashley Caldwell. I'm going to go ahead and do the NG2 insertion for this patient. To start with, I'm going to check my physician's orders, make sure this is authorized for the patient and as to why, and it's for this patient is to relieve nausea and vomiting. So to start with, I'm going to walk into the client's room, introduce myself, ask if they have ever had this procedure done before. If I can get my pin line off here. And the patient has, so they've tolerated it well before. So I'm going to ask the patient if they've had a broken nose, deviated septum, anything like that. Going to go ahead and check. My pin light is not working, but in reality, I would. So I'm looking in the back of the throat, looking in the nares, making sure there's no deviations. And then I'm going to take my tubing, and I'm going to measure my tubing from the tip of the nose to the earlobe and or around the ear, and then I'm going to take it from there down to the xiphoid process here. Okay, so I've measured. I'm going to take tape and or a Sharpie, either one, to mark this off. I should have brought this beforehand, but I didn't. And that's the end of this tubing as well. This tape. So we're out of tape. So we're going to play pretend. Okay, so this has been on there. Okay, now I'm going to go ahead and put on clean gloves, lubricate 4 inches of my tubing, and before all this started I would have washed my hands. So I'm going to place this into lubrication. I'm going to select my nair. And after lubrication, I'm going to go ahead and have the patient extend back and let them know that the insertion is about to begin. So I'm going to go ahead and insert. Okay, and then after a few inches, take my pen light, check in the back, make sure there's no coiling. If there were issues with the patient having this down or coughing or anything like that, I'd have them swallow water and then put their chin to their chest, so to help with the ease and the curvature as I go forward. Continue to advance as far as I can, and for all intents and purposes I would push this up to the tape, but on the mannequin it's not going in. So once I get there, I'm going to temporarily take this down. Again, we are out of tape, so I'm having to simulate again. I would have the patient speak to me just to verify placement, again looking in the back of the throat to make sure that there is no coiling, and then I'm going to aspirate for stomach contents. Okay, and if I get some back, that's a good indicator that I have in the correct place. And then as I push the stomach contents back, I'm going to listen in the abdomen for a swooshing sound, and I hear it, which is a good indicator that we are in the abdominal area. I'm going to go ahead and take this off and place it here. And according to hospital protocol, if necessary, I would test the pH of the stomach contents. And then for the last placement check, I'm going to send for a x-ray to make sure that it's not in the lungs and that it has indeed went into the abdomen. And once I verify all of that, I'm going to take a piece of tape, Y shape, and tape this, secure it down, asking the patient all along how they're feeling, making sure they're tolerating it well. Okay, and then once I get to that point, I'm going to use my handy dandy rubber band, make a loop, secure this down, leave a little bit of leeway, that way it's not tugging at the patient. Okay, and then I'm going to hook this up to suction, and that's good. And as far as documentation goes, I'm going to state the size of the tube, which nair I went into, the drainage that came out. I'm going to do the color, consistency, how much came out, and name, date, time. And if there was a pH test done, I would have documented that as well. Go ahead and pause it. For this one, I'm going to go ahead and irrigate. So again, I've come into the room already, verified the patient's name, date of birth, washed my hands before I came in, applied clean gloves. I'm gonna go ahead and disconnect this from suction, place it on the towel. Go ahead, get my irrigation, or not irrigate, I'm gonna go ahead and aspirate, pull back, make sure I have stomach contents. I'm going to push that back, okay, disconnect, get my 30 ml of water, or whatever it may be, okay. I'm going to push this in, push, 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 push. Okay, and then what I should get back is 30. If I get any difference, I will make sure I document that. Okay, so say I get 40 back. Okay, I'm going to take that, discard it. Okay, once I have discarded that, I have disconnected the syringe. I'm going to hook this back up to suction, make sure the patient is still comfortable, make sure there's no complications going on. Also going to advise the patient teaching of the NG tube. Let me know if it comes out, let me know if your nose starts bleeding, any complications, any difficulty breathing, anything at all, contact me immediately. And as for documentation purposes, I'm going to document that my name, date, time that I did the irrigation, how much I irrigated with, if there was any difference from the 30 ml or the residual. I'm going to document how the patient tolerated it, any difficulty, if there was any, and client's response. Also, again, patient teaching.